Pre-operative anxiety and depression predict functional outcomes after periacetabular osteotomy and hip arthroscopy surgery by Richey, Nicole Segovia, Katherine Hastings, and Dr. Stephanie Poon from the Department of Orthopedic Surgery at Stanford University, presented by Richey. The authors declare no financial or non-financial interests related to this research. Mental health factors such as anxiety and depression have been shown to be predictive of pain and functional outcomes in orthopedic surgeries. We investigated if mental health factors influence pain and functional outcomes in hip preservation surgery, specifically periacetabular osteotomy, which I'll refer to as PAO from now on, and hip arthroscopy. The purpose of this study was to add to the body of knowledge on mental health and patient-reported outcomes in orthopedics, to help clinicians counsel their patients prior to hip preservation surgery. PAO surgery is done to correct hip dysplasia and improve joint stability. Figure 1 on the bottom left shows a right hip after PAO surgery. Hip arthroscopy surgery is done to repair damage inside of a joint, such as a labral tear. Figure 2 on the bottom right shows a repaired labral tear after hip arthroscopy surgery. We included 75 pediatric and adult patients who had PAO or hip arthroscopy at Stanford University with a minimum of 1 year follow-up. Patients were between the ages of 10 and 58 years old. Patients completed the EQ-5D survey and the WHO's questionnaire preoperatively and at each annual visit. The EQ-5D asks patients to rate anxiety or depression symptoms, and the WHO's questionnaire asks about pain and functional outcomes. Overall, compared to patients with no anxiety or depression before PAO or hip arthroscopy surgery, patients with moderate or extreme anxiety and depression before surgery had worse self-reported pain and functional outcomes before and after hip preservation surgery. Interestingly, patients who reported extreme anxiety or depression preoperatively did not achieve minimal and clinically important difference for WHO's scores pertaining to symptoms, pain, and functional outcomes. Our findings suggest that clinicians should assess anxiety or depression scores before hip preservation surgery to help address the psychosocial needs of patients who might be at risk for worse postoperative outcomes.